Imagine a tranquil scene of a shimmering lake nestled amidst lush greenery with a soft murmur of water and a gentle rustling of leaves. For many, this idyllic scene would evoke feelings of peace and serenity. However, for those who suffer from limnophobia, the fear of lakes, this picturesque setting may be the source of immense anxiety and distress. Limnophobia is a relatively uncommon phobia, but it can have a profound impact on the lives of those who experience it. In this episode, we will explore the nature of limnophobia, its causes, symptoms, and potential treatments, as well as ways to overcome this fear and appreciate the beauty of lakes. It is important to distinguish this from hydrophobia, which is often misinterpreted as a fear of water. True hydrophobia is actually a symptom of human rabies. The appropriate and clinical term of fear of water is actually aquaphobia and is discussed in its own separate episode. The causes of limnophobia are not well understood and may vary from person to person. Like other phobias, it is thought to arise from a combination of genetic, environmental, and psychological factors. Traumatic experiences related to water, such as near-drowning incidents or witnessing water-related accidents, can be significant triggers for developing limnophobia. Additionally, negative childhood experiences, such as being forced to swim or being teased or bullied around water, can also contribute to the development of this fear. The symptoms of limnophobia can manifest in both physical and psychological ways. Physically, people may experience a rapid heartbeat, shortness of breath, sweating, trembling, and nausea when exposed to a lake or body of water. They may also avoid situations that involve lakes or bodies of water, such as swimming, boating, or visiting lakeside areas. Psychologically, limnophobia can cause extreme anxiety, panic attacks, and feelings of dread or terror. In severe cases, it can significantly impact a person's ability to engage in outdoor activities, travel, or enjoy leisure time. As with other phobias, limnophobia is typically diagnosed based on a thorough psychological evaluation, which includes an assessment of the individual's symptoms, medical and mental health history, and any traumatic experiences related to water. Fortunately, there are various treatment options available for limnophobia, ranging from therapy to medication. One of the most common forms of therapy for phobias in general is cognitive behavioral therapy, or CBT, which aims to identify and change negative thought patterns and behaviors associated with each individual fear. In the case of limnophobia, CBT may involve gradual exposure to lakes or bodies of water, along with relaxation techniques and coping strategies to manage anxiety symptoms. This can help individuals confront their fear in a controlled and supportive environment, gradually reducing their anxiety and fear response. Exposure therapy may start with visualization exercises, where the individual imagines being near a lake and practices relaxation techniques to manage the anxiety. As they become more comfortable, they may progress to visiting lakeside areas or looking at pictures of lakes, and eventually engaging in actual exposure, such as dipping their toes in the water or going for a short boat ride. In some cases, medication may be prescribed for phobias as part of a treatment plan. Anti-anxiety medications, such as selective serotonin reuptake inhibitors, or SSRIs, or benzodiazepines, may be used to help manage the symptoms of anxiety that accompany a phobia. However, medication alone is not typically considered a long-term solution, and it is usually used in conjunction with therapy to address the underlying psychological aspects of the phobia. There are also self-help strategies that can help individuals. These may include relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation to manage the symptoms of anxiety when confronted with their fear. Building a support system of friends and family who can provide encouragement and accompany them to lakeside areas can also be beneficial. It's important to note that self-help strategies may be more effective for milder cases and might not be sufficient for more severe instances. Overcoming limnophobia can be a challenging journey, but with the right support and treatment, it is possible to manage and overcome this fear. Phobias are real psychological conditions that cause distress and impairment and should not be dismissed. Please subscribe and share so we can help spread awareness. If you or someone you know is struggling with anxiety or a phobia, seek help from a qualified mental health professional for evaluation, diagnosis, and treatment.